Hi, my name is Kristen Wheeler. I am a fourth semester nursing student, and it's about 1:20 in the afternoon on March 28th, 2018. And today I will be doing insulin with my pen and with mixing up regular and then the intermediate. So I'm going to start with my pen, and I would start by checking my physician's orders. I would make sure that the blood glucose had already been checked, and that when I walk into the room, I would check my patient identifiers. So I would go ahead and do hand hygiene and then put on some gloves. So for my order, I'm giving 5 units from the pen. So I would go ahead and clean the insulin pen here. And then put on the needle. So with this, I'm gonna prime it with just 2. And I can see that it worked, so I'll go ahead and use this pen and administer the 5, and I would double check this with another RN. I'll go ahead and clean my patient's skin, and I'll be making sure that I'm not using the same site as any other nurses, and make sure that I'm rotating the site. And then I would wait till that's clean, until that's dry, and then I would go in at a 90-degree angle. And then I would hold for 10 seconds. And then I would go ahead and recap. And then move on to my mixing of the insulin. So I would do the same thing. I would go into my patient's room, check 2 patient identifiers, make sure that the blood glucose has been checked. I would rewash my hands and then don on another new pair of gloves. So with the intermediate, you want to make sure that you roll it 10 to 18 times to make sure that you get it all mixed up. And then once that's ready, I will go ahead and clean both vials. And for this insertion, we are doing 4 units of regular and then 8 units of NPH. So I'm gonna go ahead and insert the air into those. So I would do 4 in the regular, and then 8 in the intermediate. And then once I do that, I'm okay to go ahead and draw out the regular first. And like I said, I'm doing 4, and you wanna make sure you get all the air bubbles out. And I would check this with the second nurse. And then I would do the intermediate, which was 8, so it'll be a total of 12. And you wanna make sure you don't push any in, and you don't wanna make sure you go too far, because then you would have to start over. And then there was my 12, and you would check that with the nurse as well. So then at that point, you would clean the patient's skin again, make sure that you're rotating sites. Since this is a different patient, check where the last site had been done. And then you wanna kind of pinch to make sure that if there's enough fatty tissue, you wanna pinch so you can go in at a 90-degree angle. If not, you could go at a 45-degree angle. So we're gonna go 90 and then just push that in. And then on both of these patients, I would document how they took it. And if something was odd, I would go ahead and make sure I documented that, and I would be done.